My interest in medicine began at a very young age. My father's a neonatologist here at Baptist and has been for most of my life. As a child, when my father worked overnight shifts, we'd come to the hospital and bring him dinner. At time I saw him in his scrubs and his white coat and honestly thought he hung the moon. But as I got older, I kind of gained a greater appreciation of exactly what a doctor does and how a career in medicine really enables you to help people, and that resonated with me. As I grew older, I gained greater exposure, and more than just the idea of a career in medicine, I got great exposure, and I knew that's what I wanted to do. So I'm a neonatologist here, so I primarily work out of the neonatal intensive care unit, taking care of sick babies. Sometimes these babies are full term, sometimes preterm, as much as 3 or 4 months early. I also attend high-risk deliveries. Sometimes parents know ahead of time that their baby might need to be admitted to the intensive care unit, but in other cases, issues don't arise until delivery. One of the great things about the intensive care unit here at Baptist is that babies are born, and if needed, can have access to neonatal surgical services all under the same roof. My favorite part is definitely watching the sick become well. While the babies are here in the unit, the whole staff, we pour ourselves into each baby, and when it's time for them to go home, we can look back and know all the hurdles they've overcome, and then looking forward, we know that they're able to go home and bond with their families. It's great when graduates come back to our reunion or reach out with just simple visits to the unit or with Christmas cards. Right now I'm busy being a father to 2 young boys, so I spend my time doing what toddlers like to do. So we take frequent trips to the Children's Museum and the zoo. Otherwise, I'm trying to hone my culinary skills, so I like to grill and smoke meats, trying new cooking techniques, and I primarily like spicy food, so I cook a lot of Creole and Caribbean dishes. I like to say that neonatology is a team sport, and that's because it takes so many different disciplines to take care of a sick baby. We have the opportunity to work with such a vulnerable and deserving population. The entire team is focused on one goal, providing the best care for each baby in our unit, knowing that every decision we make has the potential to impact the rest of their life.